Over to you, Lizhen. Thank you.
Okay. Good afternoon, everyone. My name is Lizhen. Now I'm working at Erasmus MC as a PhD student, supervised by Professor Hinright. I'm gonna introduce the project ValueCare, which is value-based methodology for integrated care supported by ICT. Later on, one of our colleagues in this project, Dr. Mireia, she will share about the work that we have done now. Today, I mainly have 5 points: the aim of ValueCare project, design and planning, the consortium, value-based approach, and the work packages. Next slide, please. The aim of ValueCare is to deliver integrated outcome-based care to older people who is suffering from cognitive impairment, frailty, and multiple chronic conditions to contribute to the sustainability of health and social care system in Europe, to provide a secure, large-scale, and robust digital solution for integrated care. Next slide, please. Here's our overview of design and planning. We have 7 ValueCare pilot sites in Europe from 8 European countries. Mainly have 3 steps. The first step is development. We implement co-design such as focus group, interviews with elderly, informal caregiver, and healthcare professionals to develop a value-based integrated care framework, which is supported by ICT applications. The second step is piloting. We implement 12 months intervention. After that, we will evaluate outcome measurements in elderly, informal caregiver, and health professionals, as well as cost measurements. The third step is scaling up. Involve all the stakeholders to explore and elaborate in a business case. Next slide. Yeah, thank you. The whole consortium consists of 17 partners from 8 European countries, led by Erasmus Medical Center. We have 7 large-scale pilots to test the digital solution in Europe. Next slide. Yeah. Value-based approach mainly have 2 modules. The first one is outcome-based modules. Providers are paid based on the amount of healthcare services they delivered. Sometimes the health outcomes are also rewarded, but the key point is fee for service. The second module is value-based modules. Providers are rewarded for helping citizens improve their health, reduce the effects and incidence of chronic condition, and live healthier lives in an evidence-based way. All in all, the value-based approach aims to reach the best citizen health outcome by measuring health outcomes, to encourage patients' involvement, give them freedom to control their own health. Next slide. We have 9 work packages: data management, development of integrated care, digital solutions, pilots implementation, evaluation, and so on. Originally, we have 48 months to work on this project, but due to the pandemic situation, we got 6 months extension. Okay, that's all. Now I'll give the floor to Dr. Mireia.
Unfortunately, Lizhen.
No, one
Mireia.
second, because she's not here, but we have detected why she's not here, so she will be joining us in 1 second. Sorry for the delay.
Okay. Lizhen, are you able to carry on talking through these slides?
I think Mireia is already logged in.
Yeah, sorry.
She's here.
Yeah, I was in the other panel. I don't know why, but okay, always interesting to see other issues. So sorry for the delay. Just to give an overview of the ValueCare solution that it's already presented by my colleague Lizhen. So in this overall solution, we want to test the solution with 7 different pilot sites. So around Europe, each of them has a concrete target group, but all of them are addressed to other people. So I don't know if I can continue with the presentation. Yeah, these are the 7 pilot sites. As you can see here, there is a broad overview and the different context of Europe, and each of them has a focus on one concrete disease. For example, in Valencia in Spain, we are focusing on frailty, but in Rotterdam they are focusing on stroke. So the solution will be the same but adapted to the different profiles. So for defining this solution, we have taken into account the Codesign methodology, taking into consideration this general overview and the JART model that tries also to foster the dialogue between the different end users that participate in the solution. So here is our proposal, and that's the way we are doing in ValueCare. At the beginning of the project, we provide some guidelines in order to develop the first round of the Codesign activities, because there is foreseen at least 2 rounds of Codesign activities for both for the design of the concept, but also for the design of the digital solution adapted to this concept. And maybe if needed, we will also organize a 3rd round of Codesign activities. These are the activities that we have foreseen in the proposal. We've foreseen world cafes, focus groups, and national seminars, but because of the COVID, we have to rethink them a little bit. So can you go in the previous one and propose some new tools like interviews and things that can be do online. And yeah, now you can change. And according to the literature, we propose some practical issues. So we look for previous projects that involve older people and their caregivers, health and social professionals and managers, and see how they have done it in the past. And these are the tools they use. So we recommend also our partners, of our pilots, to implement these tools in their Codesign activities. So, and give some concrete guidelines to do that, and also some concrete questions in order to be addressed during the Codesign activities to respond to the needs of the project. Of course, we propose some questions for all of them, but each of the pilot site has adapted to the context. So the results of the first round of Codesign activities gave us some key aspects that we would like to share with you in order to give you also an overview of the things that we have done in ValueCare. These are the numbers, so we really are happy with the numbers that we achieved in the first round of Codesign activities, and also the balance between the different profiles we involve. This next slide, I think it's the activities they have implemented. As you can see, most of them use focus groups in person and online, and interviews also face-to-face and online, trying to adapt to the situation and trying to get the most of this COVID pandemic, but also not leaving any end user out of the Codesign activities, because we really want to have all of them involved. So yeah, these are some of the aspects, okay, that I can share with you later, how we manage some of the obstacles that we have for the implementation of the Codesign activities. And yeah, can go to the next slide. some lessons learned, but yeah, and now we are organizing the second round of the co-design activities. And here, that the thing that we want to share with you is that we would like to involve the same profiles as the previous co-design activities, but we also, can you move to the next slide? We have incorporated newcomers. Also because the momentum of the project in which we are trying to also explore how to exploit the results of the project. And also we are trying to organize mixing activities, trying to involve different profiles in the same activity, that this was not possible in the first round. And also we have provided new tools. If you can see in the next slide, this is the timeline. So we are going to implement the co-design activities during the next 2 months. And here you have the new tools. We have developed videos adapted to each pilot site. We have mock-ups and prototypes according to the inputs received from the previous round of co-design activities. So now the participants will be able to test it a little bit. And also we have provided new tips on how to avoid these COVID bias and how to introduce technology and how to implement these co-design activities in an online platform. And also we have provided new questions according to the momentum in which we are in the project, and trying to adapt them along the whole care process pathway in order to make understandable when the value care can be an added value and a supportive technology. And that's all from my side. Yeah.